Sexual health is a really important aspect of health in general. When we are healthy, we have a good sexual appetite, and desire is part of that. One of the most widely read and circulated articles from the New York Times Magazine was on sexless marriages and how there can be a disconnect within marriage where we go from being lovers to roommates and why that is. So, today, as the date of this recording is International Women's Day, we really wanted to talk very holistically about a topic that is quite taboo in many, many circles, but to bring it to light in a very holistic way and with the best of the best. So, I am joined today on the Girlfriend Doctor show with Dr. Michael Krychman. And I have known him in the field of sexual health and wellness from hearing him at ISHWISH, which is the International Society for Women's Health, and um, A4M, the Anti-Aging and Regenerative Medicine Education Organization. And he has been a keynote speaker, and he is, again, so well versed in this area with his own clinical experience. Let me tell you a little bit about Michael. Dr. Krychman is the executive director of Southern California Center for Sexual Health and Survivorship Medicine, located in Newport Beach, California. He's the former co-director of the Sexual Medicine and Rehabilitation Program at Memorial Sloan Kettering. And he is a clinical sexologist and has completed his master's in public health and human sexuality. He has a degree in erotology, sexual education, and forensic sexology. I didn't even know there were those degrees, to be honest. All right, so really in depth. He is also a certified sexual counselor and certified sexual counselor supervisor, as well as a clinical health professor at the University of California, Irvine Division of Gynecological Oncology, and the medical director of Ann's Clinic, a high-risk program for breast and ovarian cancer survivors. He is definitely someone I sought out, especially in working with women who have had breast cancer. We want to improve sexual function for everyone. And my whole approach to women's health has been to create bodies inhospitable to cancer. And then when someone has experienced cancer, to give them the best, highest quality of life. And really, that is my mission, to do that, and to do that for all of you. So I'm excited to introduce Dr. Michael Krychman. Hello.
Hi, how are you? Thank you so much for having me on
Ah,
the
thank,
show today.
yeah, thank you for being here, and thank you for all the work you've done and continue to do on behalf of women, and especially women who have had gynecologic cancers.
Yeah, it's really fascinating. I just got back from ISHWISH. We have the annual meeting, the International Society for the Study of Women's Sexual Health, and there was a whole seminar on cancer and sexual function. So we've really, progressed, in just, a matter of few years. Before we were really not talking about it, we were really talking only about treatment, right? And surviving. And now we're talking about surviving and thriving, really about how can we optimize quality of life. And when you look at a lot of the literature, I think, the most important issue for many, many survivors of cancer or chronic disease itself is intimacy, is how do they maintain that connection with their partner in spite of the fact that there is surgery, there's radiation, there's anatomical changes, there's hormonal changes, and there are ongoing changes. So when I say ongoing changes, I mean the ongoing changes that we as clinicians do to keep disease at bay, right? So when we give women aromatase inhibitors or medications to
Such as
quell,
like tamoxifen
right?
and Femara.
Yeah. So when we quell the disease and we, get rid of all the estrogen and all the other issues, we remove one problem, but we create another, and that's where your product specifically comes into play when we have severe vaginal dryness. As a result of cancer treatment, everybody will say, I might be alive, but I feel like I'm dead down there.
Mm-hmm.
And my vaginal health is not what it used to be. My lubrication isn't what it used to be. I'm uncomfortable. And it's not only about intimacy with a partner, it's sometimes just about putting on a pair of pants and getting out for the day. So very important to kind of look at that spectrum about surviving and thriving. And I like to kind of push it to the envelope, right? And it's not only about cancer, it's about chronic disease as well. We have a lot of chronic diseases that we are treating very actively, very common in women, all the rheumatological diseases, lupus, rheumatoid arthritis, and what have you. And we treat the disease, but we create sexual problems thereafter. So we've got to look at the big picture.
Ah, so that is so good. And one of the things you mentioned that you did just get an award too at Ishwish, which again,
Yes, I did.
highly esteemed organization, on your abstract for biopsychosocial.
Yeah, it was really exciting, and really I was kind of blown away and relatively speechless. I was giving an oral presentation on nipple neuropathy. So
So
really
let's talk
about
about what that means. That means,
that means, well, what I did in my research is I looked at women who had any kind of surgery, whether you had a lumpectomy or a cyst removed or a fibroid removed from the breast, an augmentation where you had breast increased size with implants, or you had a reduction mammoplasty where your breasts were reduced in size. Also, we looked at cancer patients as well. So anybody who had any kind of breast surgery, did they have any impactful issues related to the nipple and sensation? Because as you know, the nipple, when you stimulate the nipple, you certainly can activate, the oxytocin pathway, and it can create arousal. It is, part of the factors in orgasm as well. So we did find that there was really a high prevalence of women who were suffering from that. And really, we've gotten a long way, right? Before we weren't able to talk about the word vagina. We always
hmm
just say down there, right? We didn't talk about the vulva, the lips, or the outer area of the genital pelvic region. We didn't say the word clitoris. And we are now learning that there's other pathways to sexual pleasure, and that really involves stimulation of the breasts, stimulation of the nipples as well. So, and the data was really exciting because it's not only about arousal. We know that the breasts are very closely linked and tied to a woman's perception of womanhood, of sensuality, of sexuality, how she carries herself as a sexual being. So, yeah, it was really exciting. I presented the data. And I was shell shocked because I did know that it was important research, but it was really exciting to be recognized for that important aspect of the biopsychosocial, or as you and I might call it, the mind, body, and spirit connection in terms of sexual function. You can't just address one part; you've got to address the whole concept.
well, I think this is also really interesting too. So, what did you find? Like, what was the modality for healing once there's neuropathy of the breast, the nipples?
Well, I think it's like every other sexual health issue, right? And as a medical doctor and as a sexual counselor, I think I certainly ascribe to the biopsychosocial evaluation of sexual complaints, but I also ascribe to the same kind of facet in terms of treatment. So biologically, I'm collaborating with a new company. They've developed a product that you topically apply to the nipples before sexual activity, and it causes stimulation and it may improve sensation. It has also been looked at in a randomized trial to really look at the fact that it improves the FSFI, or female sexual function index. But that in of itself, we know biology only goes a certain way. We have to prime the system. We have to look at the totality of it. We have to look at the vaginal health. We have to look at the hormonal environment in which the woman is functioning. And we also have to look at the other facets. And I know you certainly, when I've been fortunate enough to hear you speak, you talk a lot about stress and fatigue and relationships, and how those are so important and so impactful in terms of the overall paradigm of care. So we try to look at that as well. There's sexual self-esteem exercises, and really, and as we all grow older, our bodies are changing, our responses are changing, and it's very easy to kind of get frustrated and kind of get upset. And we wish we were 21 again. But again, some acceptance is very important, understanding that things change irrespective of disease and what have you, and how to, love yourself, and how to really understand that things are ever changing. So I think those are important exercises, just as important as giving someone hormones, is really addressing the underlying and underpinnings of sexual complaints. What are the stress, the fatigue, the barriers to sexual function, right?
Right.
We know there's so many.
And there's a he said, she said component. So I remember asking, one of my patient in particular, Lori, who was, just said, I have no desire. I don't want to initiate sex. And so as I got questioning to her, one thing that came up is that she didn't like her nipples to be messed with. They were sensitive. She didn't like them to be messed with. And I said, well, did you tell your husband? And she said, oh no, he just loves doing that. He thinks that's such a turn on. I said, believe me. Okay, so how would you respond to that before I tell you what I said?
Well, I think it's really important, and it goes down to the fundamentals of biology and knowing your body, knowing your response alone before you can invite somebody to share that experience with you. And I use my words kind of carefully, because your
Yeah.
body is your own. You explore it, even from infancy. You explore, what feels good, what doesn't feel good. And that communication, I think, is very, very essential. And that's really a miscommunication. And I think, it's essential that you share your likes, your dislikes, your wants, your needs, your hopes, and then that will only enrich your sex life. I do a lot of research on couples. As very often the duration of relationship, the longer you're with your partner, the less sex you have. That's been shown in the literature. You become best friends, it becomes too much work, you're not very into it. My interest really is in those couples that the longer they're together, the better sex life they have.
Mhm.
And you know what one of the common denominators is exactly what you're talking about. It's about sexual communication.
Mhm.
It's about openness and honesty, and say, I don't really like this, but what I really do like, and what I really turns me on, is X, Y, and Z. And then they're like, I wish I would have known, right?
Mhm.
So I
Exactly.
think that sexual honesty and sexual communication, sexual exploration, novelty, certainly very, very important. We know there's so many women that don't even know. Um, do I know if my nipples are good or bad, or are they going to be arousal? Or are they going to cause arousal or pain or what have you? I haven't even explored that. So exploring those issues and being honest about the recovery and discovery is very, very important.
Oh, that's so true. I mean, I couldn't have said it better myself. Thank you, Dr. Krychman.
So
Tell
what
me
did you
also.
say? What did you
Well,
say
I
to them?
told her, I said, the biggest thing that he wants is to please you, is your turn on is his turn on. So if you're not enjoying it, what do you enjoy? And to communicate that.
And that's a really important. I love that you said the word pleasure and please. Um, I think that's really important. That was one of the themes at this conference. It's sex is so much more than just an orgasm. It's about pleasure. It's about excitement. It's about emotional connectivity, and I think the concept is, it's not only about winning the race, it's about the whole journey during the whole competition, right? So I think the concept of the journey of sexual pleasure is very, very important. And sometimes we rush through that, right? Just to get to the end game, or orgasm, or our patients come in and they say, I'm not having an orgasm, I'm not having an orgasm, what have you. But then I say, well, tell me about the experience. And they say, well, it's lovely, it's wonderful, it's super pleasurable. I think we need to sometimes change our focus.
I think I like to give the comparison, and I teach this in my course called Sexual CPR, is that a woman's orgasm is like the game of Candyland. I mean, did you ever play the game of Candyland when you were a kid or with your
Yes.
kids? So sometimes you get ice cream cones, sometimes you're stuck in the mud, sometimes you're back to zero, the starting place. And that's a very female orgasm. Or you can compare a man's orgasm, like, 0 to 90 in 6 seconds, or the Autobahn, right? Just that
Right.
high, fast speed, and then compare a woman's to the romantic Strassen. I mean, you're going to stop, look at the goats on the hill, you're going to take
Right.
the beautiful scenic routes and all of that. And I think the key thing that I learned in this is that's the also the secondary desire. So as my patients said to me over and over again, Dr. Anna, I never want to initiate sex, but I'm okay once we get started. And Bassan's uh, uh, diagram of secondary desire. I mean, I think that's
Yeah.
so profound. And when we realize that as women, we realize we're not broken.
Right. And I think, for me, I call it reactive desire. I find that, I like that you're talking secondary or what have you. But for me, it's reactive desire. And you
I
might
like
not
that.
start off in the desire phase. You might actually start off as neutral or even negative, right? So the analogy that I use is kind of like me and going to the gym. I don't wake up and say, "Yay, I'm super excited. I want to go to the gym and work out and work out." I couldn't care less. I'm busy. I have a million things to do. I have email, I have kids to take care of, I have work to do. And then my buddy says, "Oh, let's go to the gym. You'll work out." You go to the gym, you work out, you're feeling good. The stress is leaving. You're connecting with your friend, you're catching up. And then you kind of leave the gym and you say, "Look, wow, the gym is great. I should really be dedicated and go to the gym 3 times a week. And I'm going to do it. I commit to it." And what happens the next day when you wake up? You still have those 500 emails in your inbox. You still have the kids. You still have the chores. You still have the work responsibilities. And you say, only crazy people go to the gym, right? So sometimes being in the event of it is the most important issue.
Yeah, no, and I like that. I've never thought about reactive desire to the gym, though. So that's a good connection you made for me right now. Now, you touched on orgasm, and it's estimated that up to 25% of women don't experience orgasm, or 10% have never experienced orgasm, 25% don't experience it during intercourse. What have you found and as a solution to that?
Well, I think the most important thing is about it starts at the fundamentals, is baseline, right? How many women do we see on a regular basis? And I'm sure you can ascribe to that. They see women, they don't even know where their clitoris is,
Mhm.
right? So, and again, that whole journey of sexual exploration. And for me, it's more of a whole treatment paradigm. The first is education. I love the book Becoming Orgasmic by Julia Hyman. It's really about that journey of understanding what are the erogenous zones, what are the most important things that turn you on as a woman when you're being touched. And it's not just being touched; it's the pressure, the frequency, understanding and looking at, are there any underlying chronic diseases that we're missing? Are you on medications
Mhm.
that are impactful to the orgasm? And then again, self stimulation, what feels good, what doesn't, sometimes using self stimulatory products. And then again, we go to some advanced medications, that right now, Dare Pharmaceuticals is doing a project about rubbing topical Viagra cream into the clitoral tissue to help improve arousal. But again, we really have to be very careful, right? Rubbing anything into the clitoris will cause arousal. So, self stimulation exercises coupled with relaxation. And I think that relaxation and mindfulness component is very, very critical. Why? Because we tend to be distracted. And if we're distracted and our mind is full rather than be focused, then we are easily distracted and we short circuit all the feel good hormones and all the good neurotransmitters. So when I always say, when you're having sex, you should be on the playing field, monitoring your body, monitoring what's feeling good, not on the bleachers, monitoring. As soon as you step onto the bleachers, the orgasm is going to be faded or very challenging. So, sometimes women are very much in their head. right? Focusing on the orgasm and not focusing on pleasure, right? So when we focus on the orgasm and say, oh, it's taking so long, I'm so frustrated, when is it going to happen, is it going to happen already, then we're out of the experience, and
I
we're already
agree.
short circuiting all the good hormones that are going on.
And I think it's really important to differentiate orgasm versus climax. Like, I like redefining orgasm as the entire Candyland experience,
Right.
like the entire game, where climax is just that, one person wins, right? Or
Right.
that cherry on top. And
Right.
when you're able to let go of that goal, climax as a goal that anywhere between 3 to 15 second experience as
Right.
the ultimate success of intimacy, you're able to enjoy it more. One
Right.
things I like how you said sexual exploration, and I like that you talk about pleasuring, and I think it is like what makes you feel good, that self pleasuring and taking away a stigma or the taboo. That word associated self pleasuring is very broad versus masturbation, which just doesn't sound fun. But self pleasuring is another way to experience what makes you feel good, what's specific to you, and to experience more pleasure during.
Right.
And
Definitely.
the article that came out on sexless marriages, we touched on that tendency to become roommates versus the couples that you're exploring that have had an enriched sexual life.
Right.
What are some other commonalities in that group?
Well, I think one of the big issues is we think there's two issues. One is we think that should be on autopilot, right? That it's just going to work and we don't really have to work at it. It's like everything else. You don't just wake up and you're a great tennis player. You're a good tennis player because you practice and practice and practice and practice some more. And sometimes you practice when you don't even want to, right? So I think it's really important to remember that sometimes we neglect the most important things in our lives, right? Diet, exercise, sleep, stress reduction, taking care of ourselves. We're overwhelmed with responsibility. We are a nation working harder, longer hours, less vacation, less time off, less time with our family and friends. So I think it's really important to find that balance, right? And I think it is very important to recognize that you have to work at having a good sex life with your partner. It's not going to come instantly. The other thing is, I think we have preconceived ideas about what sex should be and how it should be achieved. Do I look right? Do I smell right? Is the scenario perfect? It's going to be too noisy, the kids are going to wake up, or what have you. We put on so many um, variables. The other thing is, sometimes I would say in a relationship, right, we compromise. Just think back today what you did in your relationship to compromise for your partner for the greater good. Sometimes you do a lot of things that you don't really want to do, right? You maybe go to a restaurant you didn't want to do. Maybe you empty out the dishwasher. Maybe you pick up the dirty socks when you think that it's somebody else's responsibility. But life is about compromise. So sometimes in sex, when it happens, you have to compromise as well. And sometimes you may not really specifically want it, but it's for the greater good. So I would say sometimes it's important to just have sex for sex sake. And it doesn't always have to be perfect and the stars have to be aligned and it's like the best mind blowing sex ever. But I think it's important to maintain that connection.
And do you think that that importance is related to oxytocin, the hormone of
Yes.
love, bonding, and connection?
Yeah.
I will
Yeah.
just emphasize my favorite hormone, the crowning hormone, and the longevity hormone. It's a regenerative hormone. Oh my gosh, so
Yeah.
many good things.
And I'll be giving a talk in May at the Symposium Medicus conference in Napa, and it's titled "Sexual Health is General Health:
Hmm.
Ageless Intimacy." So one of my side interests is sexual evolution. What we do and why we do it sexually is not always under our own volition. It's sometimes maybe pre-programmed, and there has to be an evolutionary response to why you continue to have sex and pleasure after procreation, right? And
Fascinating.
a lot
Yeah.
of it is about the health benefits, right? We know sex improves your immunity, it lowers blood pressure, it decreases stress, it improves longevity, it increases overall happiness, oxytocin, sleep. The list is endless, okay? Um, but there has to be an evolutionary response, and that oxytocin, which improves the pair bonding, I think is critical, right? We know that a dyad, and I use that word carefully because a coupled, irrespective of sex and gender, that are engaged in intimate behavior, they release the hormones, and that builds the dyad. Two
The
people,
bond, right?
yeah,
Yeah.
two people bonding. Really, if you think back, they can build a house quicker, they can tend to each other, they can forage for food more quickly, they can um, defend against a predator. So it was really survival of the fittest that those pair bonds were really reinforced. So there is really a reason and a rationale why we continue to be intimate when we are not procreating.
So, I mean, that is profound to think about. So, the ability we have the ability to have sex, to enjoy sex the rest of our lives, right? Barring discomfort, dryness, pain, all of those things, which we work very actively against, hormones, good health, all of that, pelvic floor exercises.
Right.
So, the concept that sex post reproductive years has an evolutionary role. Man, that's beautiful. There's an
Right.
argument for everyone listening to
Right.
have more self pleasuring or sex with
Right.
your partner and sex with your partner. And I
Right.
think that's really powerful. It keeps you together, keeps community, keeps, legacy, health, generational health. But keeping that positive and communicating through hormonal transition, menopause, struggling with vaginal dryness issues that we talk about. As women get older, I talk about vaginal health in my podcast often, and
Right.
the pH changes, and then we are more susceptible to bacterial vaginosis. So, how do we smell, and how can we, address those factors of interruption?
Right. No, certainly very, very important.
Yeah, no, I love that. So, what are some of the tools in your toolbox to do this?
For sexual health as general health or just
Sexual health
overall?
as general health. Yeah.
Well, I think it's about educating patients first and foremost. And again, my treatment paradigm is relatively simple. I always say I'm conservatively aggressive. And what that means is I start with behavioral changes that are very easy: diet, exercise, stress reduction, time management. I think those are really critical. I know you ascribe to healthy diet and exercise and
Sleep.
balance.
Mhm.
Sleep certainly very, very important, and I certainly need to catch up a little bit. I'm a little bit jet lagged, but again, I certainly understand the value of sleep, and I think more and more we understand the whole concept about stress and stress management, because we are really overstressed, and we know how chronic stress impacts testosterone, which causes more stress, which causes inflammation, and it's a vicious circle. And then we go into really conservative approaches, whether it's bibliotherapy, recommending books, just the act of thinking about sex and working towards sex. And I would say, what I recommend is you buy the book and then the woman highlights it in one color and then gives the book to their partner who highlights it in a different color. And then you reread it. So you kind of see, oh, that's important for her, that's important for him, I wonder why. So even bibliotherapy, certainly very simple suggestions, making time. I think I divide it up into a variety of different approaches. Physical intimacy is really same place, same time, right? How many times are we texting our partner and they're in the same house but in different areas? We're not spending time, physical time, watching together, holding hands, walking on the beach. Emotional intimacy, we are very often talking operationally, right? I'm going to go pick up Timmy at soccer and you pick up Sally at cheerleading, and we've got to pay the bills and we've got to do this and we've got to do that. It's not really talking about the partner. How are you feeling? What's your 1 year, 3 year, 5 year plan? Then we move into the journey of what I would call sensual sexuality, which is touch, oral pleasure, manual stimulation, really not engaging in intercourse, and then you move into sexuality. But again, I think the progression of formulating physical and emotional intimacy very, very important. Then we use I definitely use nutraceuticals, over the counter products. I think those are very, very important in terms of the overall general health and wellness. Hormones, let's not forget, hormones are very important. There's a lot of benefits for estrogen, testosterone, and then some of the advanced medications. We know PD5 inhibitors, Viagra, Cialis, and Levitra work well for men. We know that we have products like yours, like intravaginal DHEA, that you can use, that certainly revive and restore and replenish the tissue, right? And you can have more powerful orgasms, less time to orgasmic response. So there is a place for over the counter products as well as prescriptive. And then there's advanced medications that are sometimes used as well. And those are centrally acting, they work in your brain, things like flibanserin or Addy or Vyleesi. Those are certainly well studied.
Yeah, no, I agree. And again, removing the barrier to sexual pleasure. I say the three things that affect, our sexual health, and that is and connection with our partner, and that is if we're disconnected, number one,
Right,
desire, number two, and discomfort,
right,
number three. If it hurts every time we do something, why would we want to do it?
right.
And I think that's really important, and to understand the male's perspective versus the female perspective. So, do you deal with that when you're working with couples, Michael? When you have here a mismatch in goals around their sex life and their intimacy, and when you have a mismatch around desire, when how do you address the couple? Can you walk us through an
Well, I think
example?
it's about their communication skills, and I always want to know the why.
Always comes down to communication. You're
Yeah.
such a good
And
communicator.
I want to know the why.
Mm,
It's not always about the what, it's really about the why. And some of it is learned behavior, right? And what that means is, in relationships, we tend to gravitate towards roles. One person is the cooker, one person may be the cleaner, one person may be managing the money better than the other person, one person's in charge of the cars, one person's in charge of the TV. And again, I would wonder, I speak to many women and they will say, I know his script, right? He takes a shower, he puts on his lucky shorts, he turns off the television, he scooches over, and then we have a just standard repertoire. So again, I think it's all about navigating that and communication and sometimes compromise, right? When there is mismatch, it's really about understanding why. What is going on? Is one person affected more than the other in terms of stress, in terms of child management, in terms of, is there unequal job sharing in the home? And really understanding. Sometimes sex, as you know, can be used as a weapon in a relationship.
right.
Withholding sex can sometimes be as a result of bigger issues: anger, resentment, frustration, concern about fidelity, a whole variety of different things. So, again, addressing the why, I think, is very, very important.
No, I like that. And I like that you said roles. And I think sometimes we know how to be boyfriend, girlfriend, but don't know how to be husband, wife, and then don't know how to be
Right.
empty nesters, and then don't know how to be grandparents and still hot sexual partners. And so there's these, limiting beliefs, maybe.
Right. Definitely.
Yeah. So I think that I thinking of a client that came to me in practice, and the wife was my patient for a while, and finally she brought her husband in, and they'd been married maybe 15 years, and they were in their late 30s, and he said, Dr. Anna, or maybe early 40s, they were in early 40s, and he said, Dr. Anna, she has great climaxes, she has fun with sex, and she goes, yes, but she never wants to initiate sex. You know, what's going on? And I said, well, what's the first thing you do after sex? And guess what he said?
I don't know. What did you say?
Roll over and fall asleep. I'm like, I
Of
fall
course.
asleep. I'm like, of
Yeah.
course, because oxytocin makes you sleepy.
Right.
But don't you agree that time after intimacy and connection, especially after climax, when you've got oxytocin going, that's a time that bonding, that connection, that intimacy is really important. Maybe
Right.
that's the sexual evolution piece because that connects us to this person, this partner.
Right.
That cements
Definitely.
that connection. So that's that positive reinforcement. Give that time after sex. Take your time, positive, nurturing conversation.
Right. And it also, this initiation aspect is not uncommon, right? And
Yeah.
it's the roles that we play, and sometimes the frequencies are different. And when she would have spontaneous desire to initiate, it's already covered, so to speak, air quotes, covered by her partner who would initiate anyway. So, when if he initiates 5 times and she would initiate 2, she really only wants to have sex twice, right? And he wants to have sex 5 times. But if she initiated twice and he initiated 5 times, that's 7 times.
Mm.
But she says, okay, 2 times, if I don't even initiate my 2 times that I would normally want it, he's going to initiate anyway. So it's learned behavior. Initiation in sexual activity is really learned behavior.
So, couples in their 60s, 70s that are still sexually active, what is their different, like their approach, their differences to keep that sexual play active?
I hate to sound like a broken record, but
Yes.
communication, and I think even more so than communication is they maintain good health, overall health and wellness, and they are adaptable, because it's not going to be like when you were 16. It's
Right.
not. Just by virtue of being older, tired, not everybody is working the same way. So they have good sense of humors. They laugh, they explore, they vary their activity. I think those are all very, very important issues when you're talking about couples.
Yeah, I had a client when I first launched Jolva for, vulvar health and vaginal health and moisture.
Right.
One of the things I had a client reach out to me and write to me, and she was 63 years old, and she wrote, it's been a priority to have sexual intimacy once a week, my husband and I, and this is our second marriage, and we felt that was really important to continue. It was so uncomfortable and challenging. Sometimes we wouldn't have sex, but we would have time to be intimate
Right.
and connected. And she said since she started using Jolva, that just turned that around, and they were having more sexual frequency. But she says we make it, and so I got her on the phone. I was like, "Let me
Right.
talk to you. Would love to tell you because at 63, now I'm 56. So at 63, I want to be definitely continuing to have sex and all
Right.
those benefits of oxytocin, y'all. I mean, it's a good thing. So I said, well, how have you navigated and prioritized sexual intimacy into your life? She goes, we just have, Saturday night is our play night. It's our, whether we have intercourse or not, is our play night to be together, to be sensual, to be playful, to give each other pleasure. And that's a priority, she said. And
Right.
that's a priority in their life, that that's that definite once a week for sure. And that's something that's maintained. It was a bridge of connection for them to incorporate that into their lives.
Right.
And she said it just keeps them so loving and connected as a couple.
Right. Definitely. I mean, I couldn't agree with you more.
Yeah, I love that. And, in my program, Sexual CPR, I say that they're ABCs because, for CPR, there are ABCs, airway, breathing, circulation. And for sexual CPR, they're accept where you are now, B, be present, and C, communicate. And I think that, like you had mentioned, like we've got to be in the present moment and experiencing that pleasure,
Right.
communicating what feels good, and not doing in our head, doing our to-do list and our
Right.
shopping list and our carpool list and everything else. So so with this, like also with modern sexual health interventions with vaginal and vulvar laser therapies, how do you feel about those? And do you think it's better to prime the vulva and the vagina with hormones before those procedures like I do?
Well, okay, so I'll give you my evolution. When they first came out, I was very strongly negative against it, right? And because I was, everybody in the kitchen sink were doing the procedures, there was no data. It was really the wild, wild
Wild
west.
West. Hmm.
And we didn't really know what was going on. And remember, I'm also a Monday morning quarterback because I'm a tertiary referral, and I would see all the bad stuff.
Hmm.
I would see all the complications, all the failures. I wouldn't see all the successes. So I did write an article called The Techno Vagina, and then I wrote another article called Rethinking the Techno Vagina. And I think in the past several years, we've, made huge strides, huge understanding. Not the machine is not the same, and the operator is not the same, and the tissues are not the same. Just recently, the American College of OBGYN, there was an article published about, I believe, the YAG laser and urinary issues, um, making lots and lots of progress about this. The data is emerging. So I would say, I've kind of come full circle. I think there certainly is an appropriate place for these in the appropriate patient by the appropriate clinician. That's a very important issue. I think that,
Preferably someone who can handle the complications.
right, besides the complications, I think that women's healthcare providers need to embrace, accept, and take back control of the vaginal pelvic area. I think it's really important because very often people are given procedures and they're not properly evaluated or
Hmm.
assessed for other pathology.
Hmm.
Now, the second part to your question is, do I believe that people should be primed? Most most definitely. I think 100% women should get pre-treatment with hormones, whether it's DHEA, like your product, whether it is intravaginal estrogen, or even external estrogen and testosterone. I think those are really important. They prime the tissue to act and react.
Yeah, I agree. Because I think it was over a year, maybe now 2 years ago, when ACOG, our American College of OBGYN, issued a statement that postmenopausal vaginal lasers are not effective. And I think the reason for that is because they weren't primed with hormone
Right.
beforehand. And so, it's like you can't throw out something that's potentially very helpful, but also to understand, like, okay, we just got to, we have to get the tissue 10, 20 years
Right.
younger first and
Correct.
improve blood flow and circulation, all of those things.
Right.
So, yeah, so gosh, there's so much, and I honor your time, and I know that you've been traveling a lot, and I will be seeing you at Viva La Vulva event, and I'm like
Yes,
so
we're
excited you're on
excited.
that panel. I'm going because of you.
Yeah, that's
So,
wonderful.
yeah, no, so I'm excited about that. But bringing awareness, acceptance, and also, normalizing the discussion around it. Because when think we're broken, when we're feeling shame or guilt or fear about recognizing what's going on or being able to talk about it or share what we want with our partner, like you said, they may be like, oh, yeah, let's do that. Let's try that. Let's
Right.
experience something different. And we're afraid to ask, then there's that disconnect, and
Right,
we
of
really
course.
want to see the connection through our lives. So tell our audience where they can find you, get in touch with you, connect with you.
Well, I do have a website. It's drkrychman.com. As one of those accolades that you had said, I am seeing patients not only at the university, I see patients at the University of California, Irvine, as a high risk breast ovarian center. I'm a clinical professor there, but I also I do mental health and sexual health counseling. I am the HerMD clinician for HerMD California. So HerMD is a network of brick and mortar and now telehealth services. They offer menopause, sexual health, and gynecology, as well as aesthetics. I just came back from one of their centers. They have centers located in Cincinnati, in Kentucky, in Nashville, and they also have one in Indiana. So I'm doing telehealth for HerMD California for counseling services, for sexual health counseling as well. But I also see patients at my 3 locations at the university as well.
Fair to say you're a little busy. Plus, you are
Yes.
newly appointed to my medical advisory board, and I
Yes,
thank
very
you for
excited
that.
about that.
I'm very honored. I really admire all your work and the heart with which you do it, and the advancements you're making for women's health. And yeah, it's I support you 100%, and I thank
Well,
you for being a
likewise.
voice of
And
reason
yeah,
in a chaotic and wild, wild west type of field.
right. And I'm looking forward to being able to see you in just probably about 10 days or so in California. So looking forward to that. And I want to thank you for the opportunity to come on and chat with you as well.
My pleasure. Anytime, anytime. There's so many more. I could have you here for hours. That's for
Right.
sure. So, to our listeners, thank you so much for being here and listening in to this episode. He said, she said, and a very sensitive topic on sexual health and intimacy and connection. And I know that you have gotten several pearls from this. And think of just one actionable step. What's your one next right step that you're going to do based on what you've heard today, or that has ignited an inspiration for you to carry on and incorporate into your own life? So, whatever it is, remember you can ask or tell me anything. There is no such thing as too much information. And I look forward to hearing from you and any additional questions that you have, especially in this area, because sometimes we don't know who to ask, but you can ask me and I'm here to answer for you. So, be sure to share this episode with your friends, with your partner, listen to it together. Check out my program, Sexual CPR. It's great for couples to go through, but no partner, no problem. So much for you to learn and to continue to grow and evolve in your own pleasure zones. So thank you for being here. Till next time.